Before we begin, this video is general health education, not personal medical advice. Ever wondered why some people handle heat better than others? It's not about willpower, it's science. Your body cools down through sweating, blood vessel changes, and hormone signals. These processes vary by genetics, fitness, or hydration. This series explores how your body adapts to heat, backed by research. We'll avoid medical advice but may mention over-the-counter options for context. If you have health concerns, always consult a provider, like preparing questions for your doctor to get personalized care. When your body heats up, like during exercise or on a hot day, a network of sensors in your skin and brain triggers cooling responses. First, blood vessels near skin widen, vasodilation, to release heat. Second, sweat glands activate, producing sweat that evaporates, pulling heat away. These processes are controlled by the hypothalamus, a tiny region in your brain acting like a thermostat. Efficiency varies based on factors like genetics or fitness level. Your heat tolerance depends on genes and habits like how much you sweat or how your blood vessels react to heat. Staying hydrated and avoiding heavy meals helps. But if you're new to hot weather, your body needs time to adjust. Acclimization means gradually getting used to heat. Like training for a sport, your body learns to cool itself better over weeks, making it easier to handle heat long-term. When your body heats up, it loses water and electrolytes like sodium through sweat. Staying hydrated helps your blood vessels widen, vasodilation, and sweat glands work efficiently, cooling you down faster. Electrolytes, like sodium, balance fluids in your cells, keeping your thermostat, the hypothalamus, functioning smoothly. Dehydration can make these processes less effective, leaving you feeling overheated. Lifestyle habits, such as drinking water before you feel thirsty and avoiding heavy meals, support your body's natural cooling system without relying on willpower. Drinking cold water may feel refreshing, but it doesn't cool your body faster than room temperature or slightly cool water. Your body absorbs liquids slowly, so hydration is key, whether the water is chilled or not. Another myth: willpower alone helps you handle heat. In reality, your body's cooling system, like sweating and blood vessel changes, relies on staying hydrated, electrolytes, and gradual acclimation. Avoid heavy meals and sip fluids before thirst hits to support these natural processes. Improving your heat tolerance isn't about brute force, it's about gradual adaptation and smart choices. Start by exposing yourself to heat slowly, like increasing workout intensity or time outdoors over weeks. This trains your body to sweat more efficiently and regulate temperature better. Wear breathable, lightweight clothing and loose fits. Materials like moisture-wicking fabrics help sweat evaporate faster, cooling you down naturally. Avoid heavy meals before heat exposure, they can spike your core temperature. Stay hydrated by sipping room temperature water regularly, not just when thirsty. Electrolytes, found in foods like bananas or sports drinks, in moderation, also support hydration without overloading your system. These habits don't replace your body's natural responses, but make them work smoother, reducing overheating risks. If you ever feel lightheaded, nauseous, or overly fatigued during heat exposure, even after staying hydrated and adjusting your habits, that could signal your body isn't adapting as expected. These symptoms aren't normal and may warrant a check-in with a healthcare provider. They can help rule out underlying conditions like heart issues or dehydration risks, especially if you're taking medications that affect hydration or temperature regulation. Always communicate openly about your lifestyle, medications, and concerns during appointments to ensure safe, personalized advice. Ever notice how some people breeze through a hot day while others feel like they're wilting? That's not just about willpower, it's science. Your body adapts to heat using sweat, blood vessel changes, and even genetic factors. Some people have genes that make their sweat glands work more efficiently, or their skin better at radiating heat. Others may have conditions that affect hydration or circulation. If you ever feel lightheaded, nauseous, or overly tired in heat, even after staying hydrated, that could signal your body isn't adapting as expected. It's always a good idea to talk to a healthcare provider about any concerns, especially if symptoms persist or medications might be playing a role. When heat makes you feel uncomfortable, like headaches, itchy skin, or body aches, some over-the-counter OTC medicines can help temporarily. These are drugs approved by the FDA to be safe and effective, when used as directed on the label. For example, pain relievers like ibuprofen or acetaminophen can ease mild heat-related headaches or muscle discomfort. Antihistamines might relieve itchy skin from heat rash. Always follow the instructions carefully. Don't exceed the recommended dose, and ask a pharmacist if you're unsure about how to take them. OTC options are meant for short-term relief, not long-term use, and they won't replace staying hydrated or seeking medical advice if symptoms persist. Heat tolerance isn't just about your body. It's also shaped by where you live and how you behave. High humidity, for example, makes sweat less effective at cooling you down because the air can't absorb moisture as well. This is why you might feel hotter in places like Florida or Southeast Asia compared to drier climates. Social habits, like staying hydrated or taking breaks in shaded areas, also play a big role. If you're around others who prioritize hydration and rest, you're more likely to do the same. These small changes can make a big difference in how well your body adapts to heat over time. Heat stress can take a toll on your mental well-being too. When your body works harder to cool down, it can leave you feeling irritable or even anxious. This isn't just in your head. It's a real response to physical strain. Staying mentally sharp helps your body adapt better to heat. Practices like mindfulness or taking breaks in cooler spaces can support your overall well-being without replacing medical care if symptoms persist. Your body's ability to handle heat isn't just about willpower. It's a mix of biology, environment, and habits. Factors like humidity, where you live, and how you stay hydrated or take breaks can shape your tolerance over time. While heat stress may affect your mood, mindfulness and rest can support your well-being without replacing medical care if symptoms persist. Reflect on how these elements influence you personally. If you have concerns about heat-related issues, consult a healthcare provider to discuss safe, evidence-based strategies tailored to your needs. This video explains how your body adjusts to heat, but it's not medical advice. If you have concerns about heat-related symptoms like dizziness, nausea, or confusion, consult a healthcare provider. They can assess whether your symptoms need evaluation and discuss safe strategies tailored to you. Being prepared, like noting when symptoms start or what makes them worse, helps make the most of your appointment. H1. This content supports general understanding without replacing professional care. Remember, this is general health education, not personal medical advice. For individuals